I'm Mark Bovey, the BACC's Research Manager. Welcome to the first in our series of COVID-themed webinars, which will come thick and fast now. We've got the next one's going to be on Wednesday evening. In fact, this first webinar is not focused directly on COVID. It's about Chinese medicine and immunity, but with a COVID backdrop. Our speaker today is Yair Maimon. All the online sources describe him as a person of international renown, and this is an understatement. For a start, he's the current president of the European TCM Association. He has vast experience as a practitioner, educator, researcher, and speaker. He does herbs and umpteen styles of acupuncture, and he integrates all this stuff with Western medicine as well. He's headed up all sorts of prestigious centers, institutions, perhaps best known for his for the integrative oncology. He can work at the level of the most earthly yin or the most heavenly yang, but always to relieve human suffering. So it's my great pleasure to welcome Yair Maimon to our webinars today. Right, Yair, it's all yours.
Well, thank you, Mark, for this very generous introduction. And I can say just I'm an endless student of Chinese medicine. And as you mentioned, I mean, I was very fortunate to have experience both in teaching and in researching. I'll talk a little bit about our final research that was published actually 2 months ago related to immunity, and very strongly integrated into the bringing the Chinese medicine into real integration into Western medicine. So all my life I've been working also in hospitals, and closely also we're linked now to the WHO, to ICD-11, and to other things. You know, this is just a kind of some highlights. I'll start actually talking about COVID in the background, and will present few eventually models. All of them practical, all of them clinical, and we'll talk also about how we're implementing it in the clinic. I mean, although it's an hour talk, I hope that you will get out with some ideas, some new ideas, some old ideas that you're kind of refreshing. But first of all, I want to start always that we'll have a big picture before we are going to a smaller picture, and this movement will be all along the webinar on purpose. Because when we are starting to talk about immune system, we are starting to talk about Western medical jargon. You know, we are talking Western medicine. Chinese medicine, the word immune system doesn't exist per se. So we're starting first with a kind of fight between Zheng Qi, the upright Qi, the right Qi of the body, and Xia Qi, which is a bad Qi. So all our life, all the time, there is this struggle. Just on our skin, there is about 10,000 different bacteria all the time. We are surrounded by so-called hostile environment, but when you have a disease, it means that something in this balance between Zheng Qi, our upright Qi, and the Xia Qi has been altered. Just take a note that both of them are Qi. So both of them are natural phenomena. Also, when we look at pandemics, there are natural phenomena that repeats all the time. It's in the eyes of Chinese medicine, we are dealing with different types of Qi and different types of movement of Qi. Roughly, let's go like down a level into a strategy. So a strategy means we have Zheng Qi and we have Xia Qi, and then we have a result. And this relates, I think, very much to COVID because you can have roughly 3 options. Either your Zheng Qi is good, or it's slightly weak, or it's very weak. In the Western terminology, instead of Zheng Qi, we'll talk about the immunity, different components of the immune system, antibodies, its ability to create both innate and adaptive immunity, but this is all Western medicine. So Chinese medicine first will kind of pull it all together as the upright Qi, the general Qi of the body is good. If we look at the Xia Qi, the pathogen, The pathogen, even in COVID, it can have different energies in the body. It can be more damp. Heat is the very big phenomenon. It can be actually dry, it can be cold. And definitely when we talk about viruses, we'll see we are looking more and more on toxins. And the complex attack of toxins is usually not the regular. It doesn't go just Tai-Yang, Tai-In, and the regular way. It can be in different levels in the same time. So if we can say that the immune system or immunity, which will be a better word if we're talking about Zhang Qi, is good. Even though the Xia Qi is strong, the person is healthy. And we know about 70% of people are just carriers. They're exposed to the virus, but they don't have any symptoms. They're asymptomatic. If you're slightly weak and the Xia Qi, the pathogen, is very strong, then you'll probably will have some mild disease. And the most complex, if you are very weak and the pathogen is strong, then you usually get a serious illness. By the way, this can also go in the midst of the disease itself. One can move from one stage to another. With COVID, we'll talk even about another model because we know now about the immune response in these patients. So generally, when a patient comes to you and his Zhang Qi is good, you may not know even that he has COVID. That's why we have to keep ourselves all the time so well protected and protect the patient. What we do clinically, we are just adding or strengthening the immune system in whatever way we'll do in the clinic, at whatever symptoms or other symptoms he is presenting. Almost all our treatments are aimed to preserve the body's Zhang Qi and upgrade it. Obviously, we'll talk about specific points soon. If the patient is slightly weak and the virus is strong, we are less treating these patients when they have a disease. I mean, I don't think England is different to other countries. Usually these patients are either isolated or if they deteriorate, they're in hospital. They usually shouldn't come to our clinic. So you can treat them with herbs, but not with acupuncture. So the pathogen is strong, the body is slightly weak, then we get some mild symptoms. So the focus here is in reducing the pathogen. It's not anymore on immunity. So you do all the herbs. In a minute, we'll look at acupuncture points. We do everything to reduce the pathogen. If it's heat, to reduce the heat. So our focus is here. When we get the third type of patient, then we have this complex situation that on one hand, we want to tonify immunity. And then when you're getting to very complex herbal prescription or in acupuncture to more complex thinking, because you want to reduce the pathogen, but at the same time to strengthen the immune system, especially the part that is getting most effective. So this is like a rough outline of Xia Qi and Zheng Qi. Now I want to move to a different model, which is much more a clinical model of a disease, but also COVID will fit into it. So we are looking at three different stages: at prevention stage, disease stage, or outbreak of disease in a patient, and recovery stage. And today we'll see more people, again, in the first and last one, unless it's a family member or somebody you are treating in a hospital. And I want just to look through a simple prescription, and you will see just changing the different point selection will create a very different point combination or point prescription towards a different aim. So here the aim will be more Yuan Wei Qi. Okay? So in this prescription, I selected from the lung meridian, lung 9, the Yuan point of the lung. So it will strengthen the lung. It will strengthen the lung are responsible for Wei Qi, so it will strengthen the Wei Qi. But in the same time, also the Yuan Qi. By the way, all the Yuan points have this capacity, and we'll even focus later a bit on them. When we move to the disease time, the disease part, and the person has heat, then we will choose lung 10. Lung 10 being the fire point, reducing heat, and especially heat in the lung, And in the acute cases of COVID, it will be a very important point to think or to use, especially if the pulse is very fast and there's high temperature. Then if we'll move to the recovery stage, I would use here lung 7, the low point. The low point because again it has a double action, also will help to reduce some of the heat, some of the wind remaining in the body, still opening the lung and strengthening the lung. Let's look at Dumai as a second selection. So Do 4 as the Ming Men will help it to strengthen the Yuan Qi at its very root. At the disease time, we can use Do 14, where all the yang meridian meets, and it will help to reduce, actually very effectively and fast, the yang and the excess heat in the body. And then in the recovery, Do 12, which will be the next slide that I will talk about, a very important point to both strengthening the Zheng Qi and reducing some heat and wind heat. If we look at the stomach 42 again Yuan point, comparing to stomach 44, here we're using water points to reduce heat, very effective, especially with large intestine 11. And you will see this combination of Yang Ming as a very interesting combination to reduce generally heat, but also to tonify. And we are using large intestine and lung, so we are also strongly working on the lung, on the metal, the yin and yang aspects of the metal, and the Dumai. So this prescription kind of follows a certain logic. And then when we are moving to recovery stage, stomach 36 obviously is one of the kind of amazing points, and I will even mention some research, a lot of research done on that point. And again, here we are on the large intestine, so large intestine 4, the Yuan point of the large intestine, compared to large intestine 11, to large intestine 10, which is the Shao Sao Li, the Li point of the hand, and the combination of these two Li points is a especially good combination to strengthen Zheng Qi and Qi overall. So you see how we are moving into different points, into different strategies in order to tonify or sedate different aspects of the body. And obviously you can add, reduce point according to the situation, but I more want to focus that we are moving from immune system, the Western idea, into the Chinese strategy and paradigm of thinking about Yuan Qi, pathogen, and Zheng Qi, which is a more proper word to use when we are moving to the clinic, and when we are trying to select herbs and points. And actually, the Western type of thinking can be very much confusing. And this confusion will come in and out of this lecture because I'm dealing a lot with the immune system and a lot with Chinese medicine and trying to clarify this confusion. And one of the good clarification is to sometimes keep them separate and be aware that they are different in their paradigm. So I just mentioned the Do 12. It's called Shenju or body pillar. It's a beautiful point, and we are on points around bladder 13. So we are still on points on the upper part of the chest and points related to the lungs. So here is bladder 13, and on the Dumai here we have Do 12 and body pillar, and it has its dual action of both clearing heat from the lung, also the heart, but also the Zhong Qi, the upright, pacifying wind, but also tonifying the Wei Qi. You can even use it with moxa or needling. Depends if there is heat, I would just do needling. So its indication is for heat in the chest, but also for dyspnea. So very important point to me, if somebody after COVID trying to recover, still shortness of breath, still tendency for cough, because it will help to reduce this some parts of the disease that still stays in the body, this lingering pathogenic factor. And that's very unique to this virus, that the lingering pathogenic factors lingers after the disease is gone. Especially if the Wei Qi was weak or there was some lung pre-existing condition. A lot of disease will bring pre-existing conditions which already been there for a while, And if you know if it's an old patient of yours, you will understand why he responded in the way he responded. This point is called body pillar. So it's very much to do with kind of this putting you straight, like having your spine erected and you feeling more strong as far as you and the world. So names sometimes also ring some of the bell and gives you another insight to the point. It's, by the way, very good for allergies, again, especially for allergies that have some component of heat in them. Because a lot of patients, there's the pre-existing condition. An allergic patient is allergic all the time. He will just present the symptoms when there is something, promoting it or exasperating it. So this point is one of the, I think, interesting point to use for allergies, especially if there is some component of heat. So this gives you, here I put about the backbone and the spine as being kind of a good connection of heaven and earth and keeping us as human erected on earth. This is one of the places when they are painful, you will go slant, and a lot of asthmatic people will tell you, if you even touch this point, it will be tender. So we talked about two different strategies. Now I want to move a little bit to the bigger picture and just to remind us that Li Shizhen already in the Ming Dynasty was one of the first physicians along the Chinese, along medical history, human medical history, that developed the concept that disease are entering through the nose and mouth. There was a big plague in China at that time. And this was a big revelation. I mean, this is one of the things that changed changed the whole way that medical systems are helping people. Until today, the number one component of medicine is hygiene. And Li Shizhen was the first one, at least that I know, along this medical history, human medical history, that was clearly observing it and mentioning it. And he's also the author of the Ben Sao Ganmo, the companion of Materia Medica, and the 8 Extra Meridian. So one of these geniuses that we are walking in their footsteps when we are doing Chinese medicine. This is just a wonder. I'm not a very good Chinese astrologist or into Chinese astrology, but this is a young metal year, a rat year, and the metal year relates to the lung and metal. Obviously, in Chinese medicine, we very easily moving between earth and heaven or between larger picture and smaller picture. Why this year? Why lung? And why this type of disease? So this is kind of something I wanted to point out. And in the Baizi, also one of the hexagram for this year is this hexagram that has wind on the top and thunder on the bottom, which is talking about changes that are coming quickly. Actually, I look at different astrology that astrologers have put to this year before, they knew that COVID is up. And almost on some of them mentioned, that it's a year that there will be rapid changes that coming quickly because of this wind and thunder aspects. So I just thought, it's a little bit to the left to Chinese medicine, but it's interesting to see because we are still using the idea of metal and the elements and the pre-heaven and post-heaven chi. So we are moving to a bigger picture than us small humans here with our small problems. And let's go back to immunity. And one of the things I want to stress when we are talking about immune system, we are talking about a system. So immune, hormonal, neurological, they're all systems that are orchestrating the body. They're very different to a part like a digestive, respiratory, urinary, which is, I look at them as part of this kind of production of energy, so to speak, or a factory, that each system is has its own function. When we're looking at these larger systems, we are looking at something which is orchestrating life, and that's why it's so complex. It has many levels and many layers, and its complexity is due to being a system. And when we want to talk about it in Chinese medicine, we are starting always with the physiological aspect and then moving to pathology. So roughly we can divide the immune system into three. We always talk in numbers, so three is a kind of very good number to start to address things. So we'll look at Wei Qi, and many people, I think wrongly, when they talk about immune system, will talk about Wei Qi as just part of our immunity. When we go a bit deeper, we can talk about Ying Qi or Jing Qi and Yuan Qi, which I mentioned in the first model. But here I wanted to keep the heaven earth man model behind it. So Wei Qi and Jing Qi and Shen Qi is the three aspects that are keeping us healthy. So when we are looking from this model of health, we can see that Wei Qi deals more with the external pathogens. The Yuan Qi and also the Ying Qi are dealing more with internal pathogens and keeping our body intact internally. And Shen Qi talking about our communication with our Tao, with our heaven. So when there is a lack in our communication, then our immune system or immunity is suffering. And it's actually suffering very badly. Also, I may have the comment later, but already at the, I think it's a Suen 72 or Lingshu 72, they're already mentioning that if you're aligned with your Tao, if your emotions are well, then you can't get a disease. So eventually the deep aspect of human life is also Shen Qi in our ability to communicate with something which is unique to us inside. So they're all interrelated, and they cannot be separated. Also, when you treat a patient, if they have fear, their immune system immediately will go weak. If they lose trust, their immune system will go weak. So in this aspect, we are looking at this immunity from a three-dimension level. When we'll talk about Wei Qi or affecting the Wei Qi, we'll talk more about the lung. You can also use tendomuscular meridian. We can bleed. We can do needling, which is more superficial. In some cases, we can use divergent meridians. When we are going deeper into Jing Qi, we're looking more at the kidneys. I'll mention later a few points for like patients with compromised immunity, especially because I work with cancer patients. So actually their immune system is weak on the Jing level, not on the Wei level. So we need to strengthen their kidney. And we need to go into extra meridians or the normal meridians. And when we move to Shen Qi, and sometimes this is the most important part, which is being out of balance in a patient, then we're more thinking about the heart. I'm very much closely related to traumas and Gui, and we look for very special points in order to balance the patient. Very different to immune in Western medicine, which we'll talk about adaptive immunity, innate immunity, it's all its compounds which are addressing immunity in a very different way. So when we're talking about Shen, I want to spend a minute on Shen because I think it's totally relevant to COVID and the way we see the world now. Because Shen and immunity are closely related on many levels. And first of all, I think one of the deepest experience of human today is unique, and it's more on the Shen level. And I like to quote Professor Yuval Harari, who says the best defense humans have against pathogen is not isolation, it's information. And it's an interesting quote from Chinese medicine point of view. I mean, first of all, it's one of these quotes that you read it and you say, whoa, there is something in it. It sounds interesting. It makes sense. It's somebody is bringing sanity back to the picture. And this is one of the biggest problems, that the way this pandemic is conducted on many levels brings a lot of anxiety and brings a lot of mistrust and brings a lot of situations that are very creating a lot of apprehension in people. And when we look about information, the best is to use the 5-element model, because information is to do with our thinking ability, with our yi. We understand and assimilate. So, and when we, sorry, I'll move back. the way we understand things is through this almost the same process as digestive process. We take ideas, we put them in, and they become part of us. And the earth is controlling water. So the more we understand, the deeper we can kind of rationalize something, the more we controlling our fears. And the more you control your fears, the more you can bring wisdom in and not fear. And if you bring fear and anxiety, and one of the things, I mean, all day long with talking with patients, I'm trying to calm them down, about the pandemic. I mean, some, because of this too much wrong information, and the media is obviously always looking for the dramas, so there's so many fears. People are afraid to go out of their house to meet I mean, I've like older people, they're not meeting their grandchildren. And to me, this is worse than anything else, and their health is deteriorating and their mental state is becoming less stable. So with the information, you can sit a bit far away, you can be outside, don't isolate yourself. And that's, it's much more important for Darshan and to reduce their anxiety. And when we're talking about isolation is totally abnormal to humans. We like to be with other people, to share, especially to share love and to share our ability to joy and enjoy others. This is the very core. That's why we have 4 organs on the fire. Why so many organs? Why this element gains so much attention? It's because humans' complexity is on the fire, on the ability of sharing and on the ability of loving oneself and loving and sharing with others. So this axis of water and fire, it's one of the key axes for sanity and for internal well-being. So isolation, we have to understand, is actually hindering this aspect, and we should strive with patients and especially with people who we care that they won't feel isolated, and find ways and means to support them and not make them feel isolated. Oh, this is the quote I was looking for. It's so in 72. If Zhengqi remains strong, Xiaqi cannot invade the body. Zhengqi must be weak when the invasion of Xiaqi takes place. So if we put all our attention on strengthening the body, and in this model we look at the Shenqi, Weiqi, and the Jingqi, then even if a disease will come, I mean, we have people 95, 92, recovering from COVID. And so if your immune system is aligned, basically you're at your best. And Chinese medicine is a very refined medicine to address it. And we're moving from different paradigms when a patient is moving along the disease, or definitely when he's exposed to a disease. So this is, to me, a model which is worth keeping in mind. And that's why I want to spend a few slides on Shenqi and how we can help align Shenqi. And very briefly, to see how fast we are moving from theory to practice. As we say, the anxiety may arise from this imbalance of fire and water, especially when the water is starting to be either too weak or being unstable. So there is anxiety and fear, and even people will tell you fear of keeping one's sanity. When you ask patient, they tell you, well, thank you for asking, I have this internal fear, and I'm always making sure to reassure them at that level. You're totally normal. What you're feeling is normal for someone in this situation. And they're looking for your reassurance. Because as physicians, as Chinese medical physician, we don't treat just with acupuncture or herbs or other means. We're also treating with our Shen and our presence. So I think addressing this aspect is core to human life, and definitely core to keep our immunity in a good state and the patient's immunity in a good state. So forgetting this is, to me, forgetting the roots and the strengths of Chinese medicine. And it's a simple model. It's simplified. I go very deep into actually the Shen, my main interest in Chinese medicine on one side is the Shen and the relationship of the mind to the Shen. On the other hand, the very deep aspects of Jing and cancer. So depression, I go very deep in thinking about depression. Even I have some lecture when I took the DSM-5 where this is the way depression is diagnosed, and I look at 5 types of depression according to the DSM-5, which is the psychiatric book or list of how you diagnose depression. But this is again a simplified model which says that depression, we are more looking at the relationship of Hun and Po, of metal and wood. There's 5 types of depression. So I'm simplifying it to the simple model of 2 because it has in it this dynamic of points on the way we choose point. So when we want to balance fire and water, we can choose heart 7 and kidney 3. Because we are choosing yuan points and also earth points. So we are really balancing this axis. Very simple point, but very deep. At some point in my career, I went to use only strange points. I thought, oh, the normal points maybe are not good enough. But now I'm in the part when I'm going back to the simple point, because you see the strength in the beauty and also the depth in the simplicity. So just these 2 points alone can create a deep balance if somebody is anxious. Obviously, you can add some points on the chest and or kidney points or other points, to kind of make the treatment a little bit bigger. But just in a simplified way, this is simple but not necessarily superficial. And in the same way, you can understand why liver 3 and large intestine 4, the 4 gates of pain, are so effective and has been chosen as a couple because we are working on this axis. I will go a little bit deeper, maybe choose here even also large intestine 14 and here lung 3, one of the points from the windows of heaven. But it's again the style and the depth and how deep you go with points. So you see, we covered kind of quite briefly 3 different models of approaching immunity and immune system. We talked about Zheng Qi and Xia Qi. We talked about different stages of disease or prevention, disease, and recovery stage. And we focused on the Shen and the importance of Shen, not just in immunity, but generally in life, but definitely in immunity. And I think in our time, addressing this Shen part will be one of the key aspects, and patient will come to us, unfortunately, more and more with suffering on that level. So I want to move to talk a little bit about Wei Qi, which is obviously the most kind of popular synonym to immunity. And Wei Qi is a very powerful Qi, is a very superficial Qi. If you look just at the character, we have the character Xin in the way, like in Wuxing, the very strong movement and transformation, or something that moves fast, with inside again a phonetic part Wei, but also creates a strong movement. So it's a very strong moving energy in the body. And Wei Qi is always considered to move outside the channels, while the Ying Qi is moving inside the channels. And also when we are addressing points and herbs, we should think about Wei Qi and Ying Qi. Wei Qi, because it's outside of the channels, it's between the skin and the muscle. That's why when we are asleep, Wei Qi goes into the body. We have to be covered. We are more sensitive to wind, cold, or pathogens. So during the day, Wei Qi moves out, and during the night, Wei Qi moves in, and the Ying Qi obviously circulates in the channel the way we know it in a 24-hour manner, but Wei Qi also goes along with Ying Qi. So it's important to remember. And when we're talking about especially the lung, the origin of the Wei Qi is from the lower burner, but it's influencing mainly the upper burner and the lungs and the exterior parts of the body and the sweat And that's why we're inducing sweat in order to promote a more Wei Qi to the surface, and point like GV14 that we mentioned, large intestine 4, lung 11, simple points to kind of induce this kind of sweating, especially at the beginning of a disease, at the very initial stages. Another interesting point that maybe is less used is bladder 42. We stayed on the same level as the GV12 and bladder 13. So on channels, you can look them along, but also you can look at the dynamic of the channel according to the area of the body. So obviously here is a group of points which are influencing the lung, the Zongqi, and the Zhengqi. And this point is both indicated for severe exhaustion of the lung. I treat lung cancer patients, sometimes patient after removal of a lung. So I use this point in a different way. And there was some research in Japan. Unfortunately, a lot of research in Japan stays in Japanese, so it's less accessible to us, about this point strengthening white blood cells. And I must say, clinically, it's something some things clinically over the years, you feel that they're very in core, and that's how I feel about this point. And it's used a lot also with moxa. It's one of the good points to tonify Wei Qi. Also with moxa, again, for a healthy person, for a child, or somebody who is slightly with weak Zheng Qi and Wei Qi, when we want to strengthen it. So I would also like to touch on how we are addressing patients with low compromised immunity, because I see many cancer patients. Over the last almost 25 years, I'm focusing a big part of my clinic in treating cancer patients, both in hospitals, doing a lot of research. If you're interested in my publication, you're welcome to read. Unusual publications, some of them are phase 2, like double-blinded. I'll present something small, which is more a lab, but also ex vivo lab research. So I see patients, cancer patients, who are a bit different. They present a different challenge than normal people because of the drugs they were exposed to and because of the cancer. If you're very interested in cancer, every, once or twice a week, I give also this course which we focus just on acupuncture and oncology. So also you're welcome to join. But this is just to show the approach to compromised immunity, but especially deep compromised immunity. So for tonifying Wei Qi, so I'll use points that we discussed. It can be GV12, bladder 13, lung 9. So I mentioned all these points, stomach 36, I'll talk about more later. But here all the points are more focusing on this very deep ability of the body to maintain its upright qi. So it's relatively, I would say, easy case of immunity. When we go deeper of patients who have compromised immunity and maybe they're exposed all the time to chemotherapy, or a lot of the biological drugs are also reducing the marrow and therefore the bone marrow and the production of the different component of immune system, then we will go to extrameridians. Renmai with CV6, the Qi Hai, strengthening Alter Qi with stomach 30, which is part of the C of nutrition, but it's also where the Chongmai emerges. So very powerful points to strengthen Jing Qi, Yuan Qi, and replenishing Jing Qi, postnatal Jing Qi. When we go deeper, more specific into marrow suppression, I would use Chongmai, maybe with gallbladder 39, that's the hue point for marrow. And I would like to talk now a little bit about some herbal formulas, some that I've been researching and some general one, so to kind of give also the small component of herbs when we are talking about the immune system. Herbal medicine is, again, very unique and different. I would like to take just the very famous and favorite herb ginseng, which also look like a person. And it's almost unimaginable to think how ancient people, could know exactly which root is doing what. And in the same plant, the root is doing this, the leaves are doing that, and the flower is doing something else. And since I'm fortunate to have a laboratory, I must say the prediction, I bring a formula to the lab, and I have people working with me who are PhD in molecular biology, and I tell them, this formula or this herbs will work, this will work very well on immune cells, not so much on cancer cells. And this one, the opposite, and this one will do both. And my prediction, I can say in almost all the cases, is exact, but my prediction is on Chinese medicine. What we are studying or validating is in Western medicine kind of laboratory and instruments and capacities. But eventually we are showing that ancient people, they had this huge deep knowledge, and I can say it almost never fails. And that with years brings me more and more trust to classics, to ancient books, and to treat them, as a real treasure. So even if we look at ginseng, Panax ginseng, the regular Renshen is more will tonify qi, also yang, but focused a lot on qi, on recovering qi. Hong Renshen, so what we call roughly as Korean ginseng, is treated in a different way, and it will be very hot and tonifying qi, and will even rise blood pressure. And Xiangshen, the American ginseng, will actually tonify yin, and will help to even moisten the body. And Siwujia, which is called Siberian ginseng, I mean, it's not ginseng, it's a different family, but it's still called ginseng, so we put him inside. It's one of the great adaptogens, and again, very mild and very safe herb to tonify immunity, but also to help people to maintain especially Zengqi, especially through challenges, either physical challenges or mental challenges. Siberian ginseng, for example, in Russia was given to all the people who are doing sports. This was supposed to be one of the secrets why the Russian at some point did so well in sports. But also there was an interesting research with the Marine that showed that Marine soldiers that took Siberian ginseng could stand better and longer different tasks. So, and these herbs are adaptogens. This is one of the unique aspects of Chinese medicine. I'll talk later about the formula that I'm researching, and we saw this in both formula, this adaptogen nature, which means if the immune system is overworking, it will help to calm it down. If it's underworking, it will bring it up. So this is the unique thing about herbal medicine, which Western medicine fails to do. You either have this or that. The herbs that I'm using in LCS 102, the commercial part is called Tonics R. If you're interested, you can always order it. It has 3 mushrooms and 4 herbs. And the reason, this is what the research behind it is, actually hundreds of research behind the individual components and even their active ingredients. But the reason I compose this formula, and I do the opposite, means the opposite. First I see extremely good clinical results, then I'm looking what's the best way to make it. And later, because you want to concentrate in the best way, you want to make batch-to-batch consistency in the best way, and then I'm bringing it to research. So the idea behind this formula is to affect the Wei Qi, actually Wei Qi, Zhang Fu Qi, and Jing Qi. Wei Qi, as far as the body's ability, that's why we have astragalus and atractylodus, like the part of the jade screen, the Yuping Feng San, and then I'm adding herbs to protect well the Zhang Fu Qi and then the Jing Qi itself. So also the production of energy in the body. And again, clinically, I find this formula extremely effective and even just good for tiredness. I mean, I use it when in the good old days when I used to travel, you arrive to a new place and you're tired. So, but it's made in a unique way, and also we say within after 20 years, we learned how to make it the most effective possible. And obviously all the herbs are also in the research, so don't worry if you don't catch all the herbs. It's also recorded, you can view it again, so don't stress yourself with notes if you don't get everything. So this was on the tonics R, the LCS 102. LCS 101 is called Protectival, the commercial name. It's also produced in the EU, so it's used now by thousands of people. As I told you, it showed more a bigger effect. Here in this lecture, I'll also cover the immune part. It has 14 herbs in it. Again, don't worry, it's on all our published research. And I want to focus on, so I'm moving it, I know some people will be stressful, but you have it really in all our research and publications, and also on the formula itself. As I say, it's called Protective or all LCS 101. So I want to focus on one of the published research. There is a series of them. This we did together actually with Miami Children's Hospital, with Professor Melnick there, and with Professor Shoam. It was almost a 2-year project in Bar Ilan University in the immune and cancer laboratory. We did a lot of different research here, and in the publication that I've shown, there's numerous, I'll go maybe back to this. We looked into immunomodulation, which is, again, this one of the most important parts of herbal medicine. So we were able to show how we modulate immunity in many different models, both in vivo, in vitro, and ex vivo. So this is on this publication if you're interested. And what we showed also is the activation of T cells and natural killer cells. Again, this is a different formula with the same kind of abilities. And this is Chinese medicine. I mean, basically what I feel I'm helping with obviously many other colleagues to create the path to show the wealth and potential in herbal medicine to treat the immune system and cancer. To me, this is a real passion. I think, it's to me, every cancer patient should be treated with herbal medicine. I mean, it doesn't make sense not to. And then this is like one of the way, if you're interested and want to read one research about our efforts. So I call this multi-targeted approach for this formula because the new approach is targeted. So all the new medicines, the pharmacological medicine, are targeted towards, it's like smart bombs, they're going to a certain protein in the cell or something on they adhere to some receptor on the surface of the cell. But we are showing actually multi-targeted approach. And in this research, the head of my group is Professor Rosenthal from Harvard Medical School in Boston. So it's another great endorsement of our science by people of a very high grade reputation in research and cancer. And this, I say, 20 years of research is yielding some kind of more recognition. And the effect, I must say, clinically is dramatic. We see the rise we see changes in patients' blood tests, in the way they cope with cancer, in the quality of life. So it's very dramatic. And again, if you're interested in these efforts, we are actually showing all these 3 things together, and that's the multi-targeted. That's one formula is affecting different aspects of coping with the disease. And potentially prevention. This is one of my next projects. So to move away from herbal research, to go back to acupuncture, so we'll finish a bit with acupuncture. I always assume that most people are acupuncturists. It's just to, this is just to finish the herbal research. There's a lot of herbal research now, and there's even one recent publication that's why I wanted to put it out. I even went to the webinar listening to the person who headed this research. It's more a kind of overview of many different types of herbs and formula and all the way they affect immunity and especially T cells. So tumor or anti-tumor T cells. Unless you are a biologist, I must say it's not very interesting. It's very specific, but it just shows you the depth and the amount of research and efforts that is done. A lot in China, but also some of it in the West, and I'm part of some research done in America. So, but obviously there's a lot of research and very deep and very promising research into Chinese herbs. So now, lastly, we'll finish with acupuncture, and as I said, in acupuncture we look at immunity. This is part of a beautiful project which I'm doing with two colleagues of mine, Bartosz Chmielnicki and Rani Eyal, and a painter from Poland, Martina Janki, who is painting the meridians. This is the stomach meridian. So it's actually all the points on the stomach meridian and the story of the stomach meridian. We've been working on a book about it for the last 6 years. Hopefully it will finish sometime, but my colleagues are optimistic, I'm realistic, so it will take some time. But they're hoping this year, I don't know. But still, it's beautiful to watch, and this just gives you the idea of all the different meridians. Some we changed, it's a little bit older, but it's beautiful also from the aesthetic and from the memory of pictures point of view. And the project is called Gate of Life, and we call the CAM team because it's Chmielnicki, Eyal, and myself. So I'm just sharing with you some of this. I think it's for the eyes it's really a beauty. But the idea of the book is not the pictures, it's the deep inner alchemy of Chinese medicine, because the points indication, the points name are discussing a deep alchemy. I mean, it's one meridian starting from the lung, ending in the liver. And the deeper we go into it, the more we understand why a certain point is doing what it's doing and how it is doing it. This is just about a stomach 36. It's a uniting point. It actually has the three cavities, which are the source of the yuan qi and also the triple worm and internal duct. So this is one of the reasons it's called Sanli. I remember when I was a student, I was told, that Mao troops were so tired and they massaged this point and walked another 3 lees. So by this time now I know it was just a story. When you look at the name, Yezhu is food, sun has different meaning why this point is called 3. One of them is to do with this 3 cavities that it affects to do with the stomach, and Li has different. One of it is distance between 2 villages, but it's more like a cultivated field of earth or a village of 9 kind of or a place that can sustain a village. So it talks a lot about something which is sustainable and self-sustainable. And as you know, stomach 36 has so many indications because it's the earth of earth. That's the reason. It's if we look at the model at the beginning, this is the earth of earth. So that's why it's not just by chance this point, under the knee. Why there's so many options in the body. Why this point? So obviously it has a lot because of its nature. It has a lot of actions and it has a lot of potential both in tonifying different aspects of the body, even in reviving consciousness, but also in resolving dampness and in strengthening immune system and enabling better absorption. So it's huge. It can be utilized in many, many different ways. There's been a lot of research. This is the most popular point for research, and not for that reason I mentioned. This is just one research talked about acupuncture modulation immunity that kind of does a review of all the different points on immunity. So it looks at the most popular points, and obviously stomach 36 is the most popular. In this review is 25 animal research and 14 human research. So you can go into this publication and look deeper and deeper. But it's a review, So then large intestine 4 is the next, spleen 6 is the next, and we can discuss why these points also were picked. Obviously, they're very popular, but they're very popular for a reason. The point I want to mention is stomach 36 is heavily researched. for immunity and for immunomodulation. So modulating immunity is one of the kind of things that we are discussing from different aspects. And there was even like a paradigm or a model that was published for quite a while on how stomach 36 can activate natural killer cells. So we can see a different pathway from stomach 36 going to the hypothalamus, and from the hypothalamus going down and activating immunity via different pathways in the body, and especially activating natural killer cells. And again, a lot of research today is done on mechanism of action and on biomarkers. And in the near future, we are already seeing a lot of research into this direction. And I believe that this will be one of the leading factors to make acupuncture especially very, very integrated into health system. Because when you can show mechanism of action, and when you can show effects on biomarkers, it's very convincing for the Western community. And we have more and more research coming out of it. If you want, one day I can present you some bunch of researches I just lately did on cognition and biomarkers in cognition in some cancer integrated cancer conference. So we can finish with some stomach 36 combination. I wanted to give some simple combinations of points we discussed so far. So stomach 36, lung 7, bladder 42, GV 12, all the points that we kind of discussed all together, very good in tonifying qi. And when we go a bit deeper to Yuan qi, we'll combine stomach 36 with lung 9, again Yuan point, kidney 13, one of the amazing keeper of Yuan qi, and CV4. So you see I'm kind of changing from bladder to kidney, from GV to CV. So just showing a different point prescription, which are simple, easy to use, and very effective, and have a very deep logic behind them. So just to again go into the last session, I gave a whole series on immune system because everybody was talking about immunity, especially during COVID, and I realized it's impossible to teach immune system without going into its all the different facets. So I did a series of webinars. I called it the Serve and Protect. If you're very interested in watching them, they're on the TCM Academy, tcm.ac, but they are more presenting the kind of thinking that we can look more at the allergies and inflammation. We can look more at other immune aspects of immunity or on internal causes of disease. And each time we are looking on different aspects of the body. So here we are looking at more at the Wei Qi and the way Wei Qi responds to Yuan Qi, and we look at external pathogen and lingering pathogenic factors. Here we are more looking at post and pre-heaven Qi and extra meridians and the way they keep our body intact and the internal of the body in the best state. And here we are moving partially here and also here to this very deep idea of self and non-self, which is the basic understanding of immune system actually in Western medicine. This is one of the deepest challenges of immune system. And then we can explain a more, I can say, strange disease on the immune level, and also the new immunotherapy in cancer. So this kind of, I hope, wrapped up this big issue of immunity and immune system, give you the perspective from Western and Chinese medicine. I would like to end with the 4 rules of a Zen master, right? The patient who went to the Zen master and came back with these 4 rules, who I thought they're nice to adapt. And he says, keep these 4 rules, be present. And I think be present is probably the most difficult and important rule. But then the second one is be available, which I think is very interesting, especially if you're a clinician. I think our availability to our patient is a key factor. When you keep yourself available, usually you get the right diagnosis and eventually the right treatment. Uh, be playful. I think it's core. We shouldn't be too heavy about life. And not knowing, I think it's summarizing the part that is not knowing, which is the deepest and the most curious part of human life. So in this we kind of, as we saw, that vitality and Zhengqi is not just immune system. It made of different component in order to be like tigers. And I will leave you with a quote from one of my mentors. Um, and I had a few actually. I started studying in England. This is actually French. Father Lar. And I'm still a student of Elisabeth Rochat de la Vallée, which was his co-partner and his student. And Father Lar, I just like this quote, that by returning to the classical root of Chinese medicine, we can make a truly significant contribution to the medicine of the future. And it kind of keeps all the time in the back of my head when I do research, and especially when we see these incredible results. So I'll finish here the formal part of the presentation. I will close the slide and stay open to questions. So we'll do some questions and answer or sharing or whatever is fitting. So just formally, I want to say I wish you all the best of health and healing. And from Shen to Shen, thank you. Thank you for watching and taking this time.
Thank you very much, Yair. And we should, under normal circumstances, all be applauding you at the moment. You'll just have to take that as read. It's a wonderful talk, ranging over so many different ways of approaching the issue. And there are a number of specific questions. So I'm just going to go right back to the first one and go through the ones that came up originally through the chat, and then we can see if people want to also raise their hands and ask questions in person of you. So anyone who'd like to put a question directly to Yair now, please, if you could raise your hand in the participant box that you can see that's at the bottom of the Zoom screen. It'll show up and then we'll be able to come to you. Okay, thank you. But I'm just going to go through a few that were up in the chat from that came in through the talk. And the first one, I think, was from Claire asking, where does your 70% asymptomatic figure come from?
Over the last weekend, I was in a webinar of MSK, Memorial Sloan Kettering, and there was an epidemiologist giving a talk, a Western epidemiologist, and she actually convinced me how much we should keep our mask on and our patient mask on by saying two simple facts. One, she said, 70% of the patients are asymptomatic. So I'm quoting her. And by knowing that actually COVID-19 feature is that it's not airborne, it goes through droplets. So this is where I'm just quoting her. I can find out the name, but...
Okay, thank you. The next one, I think, was on about Do 12, Governor 12. And the question is, do we reduce it? So what needle action?
Okay, I have a very simple clinical approach to reducing or tonifying. And so to me, the pulse is the key. If there is excess in the pulse, I'll reduce. If there is deficiency in the pulse, I'll tonify. If I don't know, I'll do even. So that's a kind of my guiding line in acupuncture. So I hope it will answer, because it's so difficult to answer generally, and it's so clear when the patient is there. So some patient may seem excess, but they're actually deficient, and vice versa. So I think the pulse, to me, with years, serves as the most reliable decision making for tonifying and reducing.
Thank you for that. The next question was about the Shen and Shen Qi. And the question was, is this the same as kidney Qi, or are you talking about Shen as spirit? I think that was the
Oh,
question.
Shen and spirit. Yeah, yeah.
Yeah, yeah, that's what I thought. There was a question about your cancer course, but somebody else has answered that. They put up the link for it. So thank you, whoever did that. There was a couple from Nava, and I'm going to ask Nava in a minute if she'd like to perhaps ask those directly herself. There was also one from Juliet. Would you recommend, so this is about autoimmune, people with autoimmune disease, and it's, would you recommend one of your herbal formulae for autoimmune disease? And also, are such people more likely to suffer from cytokine storm if they got COVID?
It's a kind of a large question. First of all, this formula I presented, this LCS 102, is definitely good for also immune disease because it helps to modulate immunity. Many patients with autoimmune disease are receiving immune suppressant medicines or steroids, so they are immune suppressant in any way. So this is like more touching the first part of the question. The second, if they are more susceptible to receive to get COVID, well, not necessarily. I mean, interestingly enough, actually, some cancer patient and patient who receive or received immunosuppressing medicine are actually are safer from the, not from the COVID so much, but from the cytokine storm because their immune is more suppressant. I've heard few research about cancer patient and immunity and COVID. It seems that less cancer patients are getting COVID, but it's also because maybe they take better care of themselves, isolating themselves, keeping distance, etc. So we can't at the moment say anything about cancer patient, but talking to different oncologists, most oncologists see very, very few COVID cases in cancer and very, very few cancer patients who die from COVID. So this phenomena is like a clinical one. I've heard it in different conferences, people sharing it. There is some literature on it. I haven't read it, so if especially today, and if you're extremely interested in this topic, probably you can find out the research if there is already some validated research behind it. But that's the only thing I can comment. It's not directly Chinese medicine; it's more epidemiological evidence.
Okay, thank you. Nava, do you actually want to ask your question yourself, or do you want me to ask it for you? If you want to ask it yourself, do you want to put your hand up? Otherwise, I'll go ahead and ask it. Okay, yeah, I understand. Right, I'm going to ask Nava's question is, so first of all, she asked whether you're going to talk about the cytokine storm more, and then she went on to ask about whether boosting natural killer cell production would help cytokine storm in COVID. And then to ask about terms of modulating the Th1, Th2 balance and how you do that rather than just boosting Th1 on its own.
We are going very deep into immunity.
Yeah.
I forgot the first one. I just started to write because I said, "Oh, it's going to be complicated
Yeah.
question."
So and she's got, oh yeah, in a subsequent one she's got Th17 as well. And perhaps if you could just explain what the
So,
Th cells as well are to people, so that everyone's.
okay, I think I started with the cytokine storm. I mean, maybe I've put this term out, so I should also put it in some. I would say, first of all, we're discussing Chinese medicine and not biology, so I assume that most of us are not biologists, including me. So, I have, I'm maybe not the best person to answer a very deep biological question. But on the other hand, I can say that one of the interesting things with COVID is that the
Mm.
very fast deterioration uh, is mainly due to overreactive immune system. Okay, the immune system goes totally out of balance. And if we look at it from a Chinese point of view, and that's where I want kind of to bring this question more and away from TH1, TH2, we are very refining our biology, and that's what I mean. We are not targeted medicine. What we see clinically, and when I heard also different doctors from China who treat COVID-19 patients in the acute case and others, what we see clinically is a dramatic increase of heat and toxins in the body. So we see this reaction. And in Chinese medicine, when we reduce this excess, we also help to modulate the body. So, and this is why I was presenting the first paradigm. Eventually, we are treating with Chinese paradigms and with Chinese understanding of medicine, and not with immunological and with Western immunology. And some of our work get now extremely good validation in research, but we shouldn't switch our mind and suddenly be biologists. It can be very dangerous. To me, if you do Chinese medicine, do good Chinese medicine. I look at research and find a lot of comfort there, and sometimes some ideas, but I don't base my clinical behavior according to research. Research is done in very isolated environment, most of it in labs, and still it's not reflecting what's happening in the patient's body and in the individual patient that you treat. So this is just to say, eventually, cytokine storm, again, is a very Western term, but what we see in Chinese medicine, if we reduce heat and toxicity, and that's probably what we see is a reaction, and in different levels. So it doesn't stay in one layer. It's not in the Tai Yang Ming layer. It behaves differently. So it's in the different layers, in different parts, and especially in the lung. Then these patients are doing suddenly. Again, I heard from Chinese doctors who treated COVID-19 patients. So they see a very dramatic immediate response. So I think it was a lot of words, but trying to focus the question on the territory where we excel.
Okay. And Nava did go on to say also that, I mean, her experience, there was the potential to worsen the symptoms and elongate the recovery time if you were just enhancing natural killer cells TH1 response. I assume she's talking about some kind of herbal formula, but I'm not entirely sure because it's not specified. Do you think that, and in your experience, if you're, if
I
you're
would say
if you, well,
I would be more simple.
yeah,
First of all, I don't treat acute COVID patients with acupuncture, so I have no experience. I always feel comfortable to talk about things that I have vast clinical experience. And secondly, there's some herbal formula that I used, which I sent to patients who have acute disease, and so far all of them were doing well. So I feel very comfortable, about kind of general herbal approach, which is stemming out from a lot of research in China, and now a lot of feedback from different herbalists, also in the UK. I know Andrew Flower, for example, and probably have a lot of other herbalists. So I think we kind of discuss, collaborate, and we feel comfortable about some formulas. But again, the more complex the situation is, the more complex the formula. I've never seen a worsening of symptoms, or at least that I could notice.
so as a TCM practitioner, um, to to what extent do you think that it's helpful to understand the biology from a Western medical point of view?
From a clinical point of view, it's important because some of the patients, like for me, some of my patients are taking Western drugs and I have to understand how their drugs are working. So I can understand what's going on in their body. So I need the basic biology, not for the herbal medicine and not for my TCM approach, but to understand what's going on in their body if they take immune therapy or chemotherapy or biological therapies. I want personally to understand, and then from the Western understanding, I can better understand the Chinese part. This is, by the way, what I'm teaching in the course, is to understand a lot bridging this Western and Chinese medicine, because when we see cancer patients, this is the biggest challenges we have. During the Neijing times and ancient times, nobody was given chemotherapy. So so we have to figure out a lot of it, and we have a lot of knowledge. We have a lot of Western knowledge which we want to utilize to our benefit. So I think it's important for bridging this gap. But overall, as a clinician, it's not a huge importance. I mean, this is one, I can say, one of the downside of my type of research. I don't grow much as a practitioner. But the only thing that I grow a lot is the confidence in the medicine. So now I prescribe with more confidence. I know better about batch-to-batch consistency. I know better what to require from the production of herbal medicine. I go very deep in all this aspect. But for the patient, eventually I'm a Chinese medical doctor. So I try to do my Chinese medicine diagnosis the best and herbal prescription and approach the best. And sometimes I'll just treat their Shen, because I think that's the most important for the patient. A cancer patient, they have fear of dying, and this is, I leave all their biology and everything aside, and I'm there with the patient. And I think that's how we should be. So kind of using over Western medicine thinking in the clinic, at least, I find it not productive. And even the opposite, then people get into these loops. Maybe I'm doing something wrong, like, maybe I'm strengthening this pathway or that. It doesn't work this way. I mean, Chinese medicine is quite unique in modulating, and it's quite unique to work different in different patients. So I feel, as I say, that with the years of practice, I've been practicing 30 years, like you, Mark. So with years, you feel confident with the medicine. And when you do research and get good results, I mean, good results, it's not necessarily it's like you're hoping for, but when it comes, you just realize that everybody around you, almost looking at you as a lucky person because they didn't expect you to get good results. So this gives me a lot of comfort and confidence, which then I can bring it to the clinic and to the patients. But it's, as I said, I still feel totally rooted, as I think Father Lar nicely said, rooted in Chinese medicine. That's why I wanted to finish with this quote, so we kind of are left with more trust and belief that our medicine has so much to offer and to change the medicine of the future. I totally believe we are in the midst of this change. And over the last 30 years, I mean, Chinese medicine has really moved a long way. I wouldn't believe it will happen in my lifetime, so I can continue to dream what is possible for us in the next 10 years. And that's why I took also the position at the ETCMA, because I feel, we have great opportunity.
Yeah. Thank you very much. I think that's a sort of essential conversation that could go on for a long time. There were two people who had their hands up but no longer did. Tianyong, did you want to ask a question?
Okay, so thank you very much for first of all, Mike, for your organize this very, very interesting talk. Thank you, Yair. Thank you very much. Always, I joined several talk with you, but now I always learn something from you, something new. This one, my question is, your talk are mostly based on your research about the clinical practice in the hospital. Do you use herbs only to treat these kinds of patients, or you use combination of herbs and acupuncture? If you use of this combination or either separately, what's the process for treating cancer patient in your clinic, not only for research?
Okay. I can say for I mean, if we are moving specifically for cancer patients or patient with compromised or immune problem, I can say almost all, or definitely 80% of the patients are receiving a combination of acupuncture and herbal medicine. There's 20 to 30% just acupuncture, due to different reasons sometimes, sometimes practical reasons. Sometimes I feel acupuncture is magical, so I just trust this. But thank you for the question. So I think roughly I can say 70% of my patients are treated by both. And I'm talking just about cancer patient and people or people with specific immune disease. Otherwise, my clinic is, I would say 50-50 maybe. I'm very much also an acupuncturist, so I'm enthusiastic about acupuncture.
Thank you. Richard Blackwell, you had your hand up at one point. I don't know if you still wanted to ask a question.
Let's take a last question and then wrap up. So, I mean, people still have Sunday to enjoy.
Okay.
Well, Mark, I was just...
Yeah.
Oh, hi
Richard.
Another good old friend. Well, thank you.
Yes, nice to see you, Yair, and thank you. I was just going to reinforce that point that you made, because there's often concern. Hang on. Sorry, just changing my headset here. I find that people are often concerned about doing treatments which might boost immunity when there's some element of autoimmunity going on, and then they worry about but you did kind of address this, and you pointed out that we should stay with our paradigm in deciding what our treatments are. But that was my point, really, just to emphasize that it's a different approach. And just because you're doing a Chinese medicine to enhance immunity, the Chinese medicine approach to enhance immunity, it doesn't mean you're going to trigger some kind of enhanced autoimmune response.
It's a very important. I mean, thank you for bringing it, because I think there is a lot of unneeded fears that we are bringing from mixing paradigms, and you are an educator, so you know more than anyone else that people who are graduating a lot of time, feel a bit unsafe in Chinese medicine. I must say it, a lot of my teaching is just bringing back the trust in Chinese medicine. And so I think there is, and we see it, so you, Richard, and probably Mark and Tianjun, and people who've been practicing for a while, we see people coming with fears that are unrelated to the medicine. Obviously you can hear something in Western medicine and hear something in Chinese medicine that was done on some, sometimes component of immune system in some lab, and suddenly you mix them together and you create this new fear. So I think as long as we stick to Chinese medicine alone, it's extremely safe medicine. I mean, so as a clinician, I think don't bring worries who are unnecessary, and as long as you address patient in Chinese medicine, you are totally safe. I see we are here, a bunch of people are practicing about 30 years, so I think if we can bring this message across, it's an important message. And Chinese medicine modulate immunity. It doesn't strengthen it. I think that's the key point. If it's overactive, and we see it, actually, I can tell you, it's quite amazing. We take immune cells and we put, it's called LPS on them. We put like something that stimulates them. It's a kind of particles of bacteria. So the immune system goes extreme, and we put herbal formula and it relaxes it. Then we take the same immune cells and we weaken them with some chemotherapy, and we put the herbal formula and it tonifies. The same formula. So I think that's the easy thing, that when you see it in cells, you feel very comfortable about it. But I think all of us see it clinically, and thank you, Richard, because I think it's an unrelated fear or concern that acupuncture overstimulate immune system in patient with immune disease, or with autoimmune disease, or in condition where you think the immune system is overactive, and so it's just maybe good to make this point.
Thank you. Yeah, that certainly fits with my experience, and I'm sure that's reassuring. And just to add that we're all looking forward to that points book, so keep up the good work on that. I'm going to read that one.
It's been a journey, I must say. It's a very learning journey for me. So I must say my partners are also, we spend a lot of time digging into Chinese medicine, especially the acupuncture part of it. So I think it will be good maybe to end on this note, so you will have some of the Sunday to enjoy. I want to thank the BXC and Mark and Fiona for organizing it. And although I didn't see you all, for some reason you can feel it, there's a good energy and there is a good feeling about it. So I want to thank you all for joining and taking your time. So thank you all.